Hi guys, thanks again for the great questions. Today's listener submitted question is, how do I know if my patient is dehydrated? Great question. We see it all the time, and with the hotter months coming around, people are more active, more exercise. We see it a little bit more. So dehydration can be a real big thing. People, a little easier, they go drink Powerades, Gatorades, water. Canines, they don't always follow directions very well, despite us telling them. So, what are some things that you as the client can look for at home to kind of watch for that? Is A, pay attention. Is the patient panting more, doing things? Do we seem a little more fatigued? That'll be one first start. Two other things that it could be for looking for dehydration is check what's called a skin tint. So the scruff on the back of the neck, you pull it up. Normal should be on a middle-aged person. You should pull it up. You should have a nice little snap back. That means you're well hydrated. If it stays in place, that means you're dehydrated. Another way of kind of me trying to explain that for you is take a 20, 30-year-old, pinch their skin, should snap back, then kindly ask an elderly person, we'll say a 80-year-old or so, and lift their skin and let it go. It won't go back, won't snap back quite as fast as a 20, 30-year-old. Variety of reasons for it, but that's kind of to give you the visual. Some of that will stay up there longer versus snapping right back down. Another one is look at the gums. They should still be nice and pink compared to other patients, or look in the mirror yourself and do that. And then make sure they're not tacky or too dry. They should be a nice, moist pink color and texture and feel. Easiest way for owners to get an idea on what's normal, start checking and figure out what's normal. And the only way to do that is start looking and doing it yourself. And then you have a baseline to compare to. Then if you have any concerns, just follow up with your veterinarian and go from there with it. But otherwise, thanks again, guys. Once again, we appreciate all your support and thank you for the positive feedback. Bye.